But if you want a true bond, we add in the additional bonding agent. So on the prep, I do coat the prep with some 35 minutes in the mill. Once the design is done, 35 minutes to mill a fully centered zirconia crown. You can see it's attached to the sprue. I'm holding the mandrel, and there's two differences of the crowns coming out of the chairside mill and the lab. The lab air abrades and sandblasts your restorations. The air abrasion of the Intaglio, which I'm doing here on the external surface, but air abrading the internal will activate the surface for optimal bonding. It increases the surface energy, increases the surface area, better bonding. But now we're gonna get the restoration cleaned up for delivery. So that substance that we use to clean the Intaglio, that's Ivoclean. If you are gonna bond resin, any adhesive resin, any self-adhesive resin to zirconia, you need to clean the surface because phosphates, salivary phosphates, will inhibit a good bond to your resin. So phosphates we like for bonding, but you have to clean the salivary phosphates off to apply your MDP primer. So after we clean with Ivoclean, we use Monobond Plus. Monobond Plus from Ivoclean has both Silane and MDP in it. There's other dedicated MDP primers out there, Z Prime from Bisco. And the cement that we're using, this is the Glidewell BruxZir cement. The BruxZir cement is a self-adhesive resin cement, very similar to the RelyX Unicem from 3M, the yellow cement. But if you want a true bond, we add in the additional bonding agent. So on the prep, I do coat the prep with some Scotch-Brite Universal. It turns the self-adhesive resin into an adhesive resin. The cement alone is more viscous. It doesn't flow into the tiny channels on the tooth. The adhesive, the bonding agent, much lower viscosity, it's more runny. It's gonna bridge the gap much better. This cement cleans up really, really well. We tack cure. It self-cures in about 1.5 to 2 minutes, but we do tack cure, just get it to a nice gel state and pop off the extra. And maybe still a little bit light, but zirconia is much brighter. Zirconia is higher in value, or the brightness. It's a great fit. These restorations, same-day BruxZir crowns in our clinic, for myself at least, about 2 hours. Sometimes we get them done in an 1.5 hours. Depends on how much caffeine I've had in the morning to prep faster. 1.5 to 2 hours on a same-day BruxZir crown.